Our next speaker, I'm pleased to have my other partner, Dr. Roth, come and speak to us about some of the activities that can support healthy lifestyle and fitness and muscle strengthening in the life of Exstrophy. So, there she is. Lizzie, would you like to come to the podium, please?
I see why Rachel was standing on her tiptoes. This podium is not made for short people. Ooh.
Inspired by Rachel.
Upgrade. We got a stool. For those of you I haven't met, I'm Dr. Elizabeth Roth. I'm one of the trio of surgeons and pediatric urologists here at Children's Wisconsin. Before I launch into, I know it is the last talk between you and a break and a snack, so I'm going to try really hard to keep us on time. But thank you all for coming. Thank you for being interested and engaged, being such a pleasure to work with in the clinic as we work through what can be very difficult health challenges sometimes, and for just sharing your wonderful children with us and for giving us an opportunity to watch them grow into amazing humans. So I'm going to talk, and you've heard us talk a lot through our MyBack philosophy about how our big philosophy is that we believe that we can do our best work as surgeons when we do a great job early in life at putting the anatomy back to normal or as close to normal as we can, and then allowing growth and development to happen. So you heard Dr. Roth talk about bladder growth and development, developing capacity. You've heard other people reference sort of pelvic muscle strength development, those things that happen through childhood. And so my talk today is going to be to talk and think about how we're thinking about that development in terms of muscle strength, coordination, and just thinking of exstrophy and exstrophy care in a more holistic sense. So my goal is I'm going to arm you with the science as best I can in an area that we're still really just starting to understand about how being active, being engaged, and doing as many things and following your passions in childhood and beyond can support success as a person, but also as a person specific with bladder exstrophy. So like all things, this comes with an origin story. This is yet another Dr. Canning story. But there was an individual patient that he shared with one of the wonderful nurse practitioners at CHOP. And this individual would come see Dr. Canning every fall and report that she was doing great, her continence was great, she couldn't be happier, everything was going well, and everything was great. And then she would come check in the spring with the nurse practitioner and say, I don't know, everything in the fall was going great, but now stuff isn't going so great, I'm leaking a lot more, everything is not as good as it was, I don't know what's happening. And it took a couple of years of these cycles, and they got together, and they would argue about whether she was doing well or whether she wasn't doing well. And finally, Joy, who's the nurse practitioner that was involved in her care, said, well, what are you doing in the summer? And she said, well, every summer, it's really great. I get to go, and I ride horses, and I take care of the horses, and I'm outside and doing stuff that I love every day. And it sort of really started us as surgeons thinking about the ways in which the things that we do when we're not at the hospital can support health and growth and healthy development. So we'll talk a little bit about core muscle strength and development, why it's important. We'll talk a little bit about why children and individuals with exstrophy are maybe a little bit more prone to have motor and muscle impairments. They may be more prone to have muscle weakness. We'll talk a little bit about the benefits of movement and activity, both in general and in ways that are specific potentially to bladder exstrophy. I will tell you up front, we have not studied this enough. We do not know about this enough. There's exactly one study that I will quote in this entire presentation that is actually bladder exstrophy specific. Everything else is what we've learned from other groups of children, from other groups of patients, but that share important parallels and may be able to bring us new knowledge and new paradigms for treating bladder exstrophy. And then the question that parents always have, we all want to protect and set our kids up for the best, but in anything we do, there's risk. What is the realistic risk? We get worried about playing football, playing soccer. What if they get hurt? What is the risk of those things happening? And so we'll talk a little bit about statistics for sports injuries specific to kidneys and bladder and genitals and things that we deal with as urologists. So anybody who's had a baby remembers, and in their pediatric visits, it's pretty burned into their brain. Babies have to do tummy time. They have to figure out how to lift their head. Eventually, they'll roll over. Then they sit up. Then they crawl and get into everything in your house. And then they eventually start cruising the furniture. Then they're running up the stairs, and then all bets are off. Another way to think about this, though, is that it's motor progression on motor progression. So you can't lift your head, you can't sit up if you don't have an abdominal core and muscles that will support you in a vertical position. Once you start figuring out that, then you'll start to get some shoulder stability, some hip stability. That supports running, it supports throwing, it supports all those other motor movements that we learn later on. And eventually you get to those other finer motor skills that will eventually inform writing, ability to play video games in the gaming truck, and all of those other things. And so all of those things and all the motor development really starts from the core and it works its way out. So why do we think that children with bladder exstrophy and other individuals may have some risks for motor impairment? This is where we really lean on work that other medical professionals have done in other populations. And we don't really have quantification for this in our exstrophy populations just yet. So we know from work done in congenital heart disease that it is now an integrated and a mandatory part of being treated for congenital heart disease. They have shown really clearly that if you spend a lot of time in the hospital, particularly with your movement being restricted and you have early surgery in early infancy, that those children have a statistically higher rate of gross motor delay and needing birth to 3 type interventions, to the point that that's now part of protocol for anyone born with congenital heart disease, and they get automatically referred just because by virtue of their diagnosis and the early need for treatment and care during a period of critical development, we want to monitor and observe and treat for those gross motor delays. We know that in NICU babies who have things wrong with their intestines or with their abdominal wall, that when you need early surgery, which can be important and life-saving, that it also results in a certain amount of scar and a certain amount of decreased abdominal muscle function. And so we need to be mindful of those things in an exstrophy population because they share some similar characteristics. We know from general children who have incontinence and accidents, who have no anatomic differences, that when we send them to our physical therapy colleagues and they do assessments head to toe, that the most common things that they find associated with kids who have accidents or incontinence is they find that their lower abdominal muscles are weak, particularly the deepest layer of the abdominal muscles called the transversalis abdominis. And they also find proximal leg and proximal hip strength weaknesses in those populations. And also we know a certain amount about hips. We know that when you are born with a pubic diastasis, oftentimes the hips can be a little bit externally rotated. This is the area where people have actually looked at this in bladder exstrophy, and at least in the limited series that exist, they didn't show or didn't report a significant increased incidence of hip problems in the populations assessed. But we do know that in a bladder exstrophy population, they commonly will have what's called acetabular retroversion, or that the leg bone and the ball part of the hip socket sits in the joint in a slightly different angle than other patients without pelvic bony anomalies. And we know that in other populations who have that finding, that it can be an increased risk for symptomatic hip pain. So we're going to talk a little bit about youth sports. I will tell you, I am a mom to 3 boys who play every single ball sport in existence, much to my chagrin. However, I am not sports specific, and I am not a sports snob. I would include things like dance, theater, things like martial arts, anything where you're moving your body in intentional and new ways, anything where you need to learn a new skill that promotes balance and coordination, all counts as a sport. But all of my stats are kind of specific to sports because it's what I got. So sports are one of the most common things that kids do in the world. Over 50% of the population participates in some sort of sports team or lessons, although numbers are declining according to national level studies. This is a recognized issue that even the government has recognized and set a goal of increasing youth sports participation to 63% by 2030. It's also big business. If you've ever had a kid in a sport, you find that as soon as you get in, you find infinite ways that they can be more and more and more and more engaged in whatever it is. And parents spend to the amount of $15 billion in 2017 dollars, probably more today, on sports every year. We know that female participation in sports is growing, and that the classical basketball, baseball, soccer, those still dominated popularity, but things like martial arts, dance, all of those other activities are also rising. And in fact, here in Wisconsin, we have barely cracked the top 10, so we are the 9th highest participation by state. This is just a snapshot and a breakdown. You can see where numbers between 2017 and 2021 are declining versus growing. The fastest growth being in females and being in those whose household income is less than $25,000. So we'll talk a little bit about the benefits of sports. I'm not going to belabor all of it. But it is worth thinking about it in terms of both general as well as Exstrophy specific potential benefits. So, and all of these stats are backed up by science and national level data on sports participation, and even some international studies. So we know that if you're more active when you're a kid, you're more active as an adult, to the tune of an 8-fold increase in being physically active in your mid-20s if you were active regularly as a child. There is real risk of decreased risk of adult onset diseases like diabetes and hypertension associated with increased levels of physical activity. And we know from every news article and every popular news sport that obesity in the US is a problem. We also know some other information. Teenagers who play sports, teenagers who are on a team or part of an activity of some sort are less likely to have substance abuse issues and smoke cigarettes in high school. When we look at bladder exstrophy, we have convincing data from other incontinence populations that doing things that increase your core muscle strength specifically also play a role and also will automatically provide improvements in pelvic floor strength. This was a study from individuals who had a radical prostatectomy, and they found that when they gave them targeted exercises for their abdominal strength versus targeted pelvic floor exercises, which any of you who have had to try to help either yourself or your children do targeted pelvic floor exercises, it's really hard. It takes a lot of coordination, and it's really hard to do. It's a lot easier to do crunches than it is to do really good pelvic floor exercise. And they found that abdominal muscle development did almost as well as pelvic floor specific training at improving incontinence. Also, hip stability. A study with looking at children with hip dysplasia who had some of these findings on x-rays that were similar to the bladder exstrophy population. When they looked at high school football players and did MRIs on football players, the ones who had better muscle strength had better cartilage when they were in high school, which hopefully will translate into fewer hip problems in adulthood. Come on. We know from multiple studies that being involved in sports and other team-based activities improves education. A French study where they gave kids extra academic time at the expense of extra classroom time found that letting kids be active improved their classroom performance even though they were spending less time overall in the classroom. There's a lower dropout rate in high school in those involved in sports and other activities, and also high school athletes are more likely to attend and graduate from four-year universities. The benefits of physical exercise in terms of reducing stress, anxiety, and depression are well known, as well as improvements in self-esteem. And there's even some data suggesting that being involved in regular physical activity has some mitigating effects on early childhood adverse experiences. We know from a bunch of talks that adolescents with exstrophy can be very vulnerable with their mental health. We heard from our panel that they are often worried about accidental disclosure, about how to participate in things, and early involvement and early successes and finding the ability to overcome obstacles hopefully has the opportunity to increase the resilience of children with exstrophy as they go into those vulnerable adolescent years. There's social benefits, and most of these are on a societal basis. Being a part of something bigger than yourself is really good for you. It improves moral reasoning in children, fair play, personal responsibility, and sportsmanship. People can find strong role models and coaches and teachers and other people that are involved in these activities. And you can also provide a way to, lost my train of thought, sorry. You can find a way to work with people who may come from very different backgrounds and who you may not have anything in common with besides the shared activity that brought you together. From a financial benefit, these are governmental studies looking at healthcare expenditures. If the United States were estimated to achieve their participation goals with a 63% sports participation rate, the estimated healthcare savings from the increased participation would be about $57 billion. I didn't make that calculation, but it's a lot of money. And individuals with 30 minutes of activity 5 times a week have on average $2,500 less annual healthcare expenditures per year. But what if they get hurt? That's often a concern that we hear about. Most children and individuals with bladder exstrophy have undergone at least one major surgery, often more than that. And the last thing that anyone wants to do is compromise all of the things that you've already been through for something like a sport. So looking at national level data of what are the risks of genitourinary trauma in sports, roughly 25 million children play sports, and there's roughly about 3.5 million sports-related injuries. So there's approximately a 10% of children will have some sort of injury, most of which are minor bumps and bruises, most of which are not significant or serious. An estimated 0.25% of the injuries reported are specific to the bladders, kidney, or genitals. About a third of them are sports related. The most common reason would be motor vehicle accidents, being involved in a car crash. And nearly all sports related injuries are blunt, most commonly to the kidney and the external genitalia. Girls are daredevils and have more injuries until about age 7 when it flips and then boys take the cake. And most, over 90% of trauma management for renal, bladder, and genital injuries is conservative, meaning we monitor it, we make sure it heals, but we don't need to do surgery or major interventions for over 90%. All that said, when it's serious, it makes a lot of headlines. And you can find all kinds of headlines about especially kidney injuries, especially with things like football. The overall rate from published studies of having a significant kidney threatening or kidney loss injury is less than 1 in a million. So it is far, far less common than what it appears in the popular press. We always worry about the kidneys, and we certainly, the thing that we worry about the most is what is the risk of kidney failure or needing a transplant. And so this was a national level study looking at almost 100,000 patients, most of them adults, but not exclusively, who ended up having kidney failure or needing a transplant. And 0 out of 96,000 patients had their renal failure or need for transplant because of a traumatic injury. 0 out of 96,000. Converse to that, almost half of them had end-stage renal failure from medical conditions that are known to be associated with inactivity. Being sedentary and being overweight are known risk factors in the nephrology literature, and being active is a protective factor against kidney damage in a long-term, lifelong setting. So we'll kind of wrap it up. There's a lot of benefits to being involved in something. It doesn't necessarily have to be a team sport. There's many activities, but active, gross movement, learning new skills, achieving mastery in something has a lot of benefits for growth and development, both in terms of motor development as well as in terms of self-esteem and mental health resiliency. Injuries are common, but GU involvement is pretty rare, and most of it can be managed without any need for surgery and without devastating complications. Riding sports, bicycles, equestrian, it just is a little bit higher than in team sports, and we don't, on a general basis, recommend against participation if you only have a solitary kidney or a solitary testicle. I will say this is general statistics. If you have particular concerns related to your anatomy, it's good to talk to your doctor about what the relative risks and benefits of participation in activity are for you. And this should be part of the discussion and individualized as part of your care and management. The most common modification that we recommend for our families is that anybody, whether they use a catheter or they don't, but it's always a good idea to pee before you go do whatever you're going to do. It's just good practice. And that we continue to think about muscle development and how being active may support some of the things that we work on as surgeons in terms of developing core muscle and proximal muscle strength and the ways that they may impact pelvic floor muscle tone and success and potential for eventual continence. So thank you very much. And with that, I will turn it back to Dr. Krieger.
Yeah, and if you